Welcome to Celebrating Act 2. Celebrating Act 2 is the user manual for the second half of your life.
Hi, and thanks for joining us again on Celebrating Act 2. I'm John Coleman, and this is my partner, Art Kirsch, and our special guest today, a regular guest, our medical expert, Dr. Liz Lister. And before we get going, guys, I just want to remind everybody that they can subscribe to us on YouTube and get notifications of all our videos. And they can also like this video, which I hope they do. We can use all the likes we can get, don't you think, Art?
I think so. Well, you're a pretty likable guy, John.
Thank you, Art.
And I'm working on it for me. So anyway, let's not waste too much more time here because Dr. Liz has some updated information, I hope, on how this summer is going because a couple of weeks ago we all heard that the summer was going to help tamp down the spread of COVID-19. So, Dr. Liz, how are we doing?
We are not seeing the decrease that we were hoping for. You gentlemen and people listening know that the flu is more common in the winter, and in the summer months, people tend to not get sick as much. And then we head into the fall, and we go through a cycle where people start to get sick again. Flu season, as we call it. And everyone was hoping for that with the SARS-CoV-2 virus. Unfortunately, we're not seeing the seasonal changes that we were hoping for. All right. So first of all, we've got this virus all around the world at this point, as everyone knows. And I have family in Argentina, and so I talk to them all the time. And the lower hemisphere of the Earth is suffering just about as badly as we are here in the United States. Luckily, some parts are getting things under control. So we're not seeing that seasonal decline that we were hoping for. I think the opposite has happened. I think the warm weather has brought people out of their tired of being sheltered at home and getting together at barbecues. And unfortunately, we're seeing more community transmission than less.
So we're not getting that hoped for seasonal decrease. And is there one item or kind of things that you think have particularly happened that has caused this, we call it what, community spread, because more people are out, and how we might be able to help better control the summer season?
Yes, we've learned some important lessons from the early hotspots in the United States, particularly New York City. I have a close friend who lives there, so I've been in touch with her from the very beginning of all of this. And it's been very interesting to learn from her. They pretty much adopted face coverings. I know there's been a lot of discussion of masks all this time, which led straight into a discussion of personal protective equipment or PPE. People can use, we now know this, there's a lot of studies that we now have the results on that just using face coverings, I have quite the collection of scarves and masks that loop onto my ears and just even hang straight down, not necessarily directly covering in the uncomfortable way that makes people not like the masks. That even those types of face coverings are shown to decrease at least the community spread between people. When I wear a mask or some type of face covering, the droplets from when I'm speaking are not going to reach you. It does a reasonably good job, better than we thought.
You know, Dr. Liz, the mask, I've always felt, even though Art and I disagree on, let's say, how much we should go out and into public, the mask, we both agree, the masks are the easiest, simplest, fastest, most convenient way to protect each other and ourselves. And I'm surprised that the message hasn't gotten to the younger generations who now kind of act like they're immune, because after all, they're not going to die from COVID. it's the old folks that are going to die.
Or are
So
they?
it's
What say you,
Yes,
Dr. Liz?
the percentage of cases in young people it's shifting over to younger ages because of exactly what you're talking about. It's really unfortunate and it's really scary. And of course, the biggest problem with young people getting the virus is the spread among people who don't have symptoms. This is where it really gets to be. I mean, the whole thing is really difficult and really challenging. Nobody's happy with having to wear masks, with having to stay at home. It's been very difficult. We all know the impact it's had on the economy. I think it's made us sit still long enough to consider other important issues that this country has. We're not going to get this today into the political unrest that we've been seeing. However, I think it's important. I think it's a step forward. We've all had time to think about important issues since we haven't been running around dealing with our usual daily activities. So we've had more time to think about things. But it's important to stay healthy, keep our immune system strong. And like you said, John, protect each other. My mask protects you and your mask protects me. That's the main way. Although the mask also protects me. Okay. If I happen to be around somebody who's an asymptomatic carrier and they happen to be laughing or we know that speaking more loudly or laughing or haha, there are ways to make more droplets project out. And if I happen to be around an asymptomatic carrier, then I will be more protected by wearing the mask, even if it's not a full level N95 mask, which our healthcare workers need who are on the front lines.
So the lesson today really is wear your mask. Whether the rate of infection goes up or down or whatever, it's wear the mask. And hopefully there'll be a vaccine soon, but we can't count on that yet.
By the way,
Correct. Yes, go ahead.
no, you're on.
There are many vaccines in progress. Just at the time of this recording, which probably I know the numbers will be even better by the time people are listening to us. Right now, there are about 24 vaccines in clinical trials around the world, and another 140 almost that are in preclinical evaluation, where the vaccine actually exists. They're just testing it out before they do human clinical trials. So we can anticipate a vaccine sooner than later, although I'm sure people will be hesitant to use the very first one that comes out. But there are already human trials going on in some parts of the world.
Well, as always, Dr. Liz, it's fascinating to get your take based on your research and the fact that you are a medical doctor as opposed to undoctor Art and undoctor John. And we certainly have opinions, but we don't have as many facts as you do. But for people to find out more about the things that you do, up-to-date information, because I know it seems that every other day I'm going to your website or watching something on LinkedIn with topical information on not only COVID-19, but other things. Where's the best place for people to reach you?
My website is absolutely the best way to reach me. It's www.drlizmd.com, DRLIZMD.com. Has a blog page, it has a contact me page, it has all kinds of information. I'm constantly adding and expanding and improving my website to give you up-to-date and useful information.
Well, that's great. And also, I'd like to remind our listeners that they can subscribe to our YouTube channel, Celebrating Act Two, and find a playlist of Dr. Liz, MD, and just watch, I think there's well over a dozen recent interviews that we've done, and lots of topics that I'm sure will be of interest to many of our viewers. So we thank you again and look forward to speaking to you the next time.
Thank you.
For more on Celebrating Act Two, visit our webpage, follow us on Facebook, subscribe to us on YouTube, and tell your friends. Celebrating Act Two is the user manual for the second half of your life.